Welcome, bienvenidos, bienvenidos. I'm so happy to have you with us again. And today, this is our agenda. We will have a presentation about the evidence-based approach, the need for data, from Kenneth Svensson. He's a special advisor at the traffic safety in the Swedish Transport Administration in Sweden. Then we will have the polls that will lead to the discussion. The panel will be moderated by Fred Weckman, and we have 4 experts that will be working and commenting and taking your questions. We will have final remarks. And these are all our cities that I want to welcome very warmly. We also have other cities, not only these 24 in Latin America that have been joining us throughout this series. So welcome to all of you. And of course, I want to acknowledge our partners that have been so fundamental for the Vision Zero Challenge, the FIA Foundation, the Fundación Gonzalo Rodriguez, the Inter-American Development Bank, the International Transport Forum, Latin NCAP, the Towards Zero Foundation, the Vision Zero Academy from Sweden, UKAID, the Global Road Safety Facility, and the World Bank. And this initiative needed support, so we had very generous sponsors, 3M, the PTV Group, and Volvo. Thank you to you. Once again, just to remind you that you should use the chat to post your questions. Use the all panelists and attendees function, please. And let me introduce you today to our guests. Kenneth Svensson is a special advisor on traffic safety at the Swedish Transport Administration. Welcome, Kenneth. If you would like to turn on your camera just to say hello.
Hello, nice to be with you today.
Very nice to have you with us. Thank you, Ken. And we have our dear Nan Tran. He is the head of the Safety and Mobility Unit at the World Health Organization in Switzerland. Hello, Nan.
Hi, everyone. It's a pleasure to be here.
Delighted to have you with us. Sarah Whitehead, the Public Health and Preventive Medicine Consultant at Vital Strategies. Hello, dear Sarah. Would you like to turn on your camera to just say hello?
Sorry, I was on mute. Good morning. It's lovely to be here. Bom dia and buenos dias a todos.
Hello, Sarah. Thank you for joining us. And we have Segundo Lopez. He is the International Data Coordinator for the WRI Road Center for Sustainable Cities. He is joining us from Colombia. Bienvenido, Segundo.
Thank you, Claudia. Hello, everybody. Hola a todos, hoy a todos los participantes. Muchas gracias por la oportunidad. Thank you for the opportunity, and I hope I can be of any help.
Very good. Thank you, Segundo. And Fred Weckman, Professor Emeritus in Traffic Safety at Delft University of Technology. Welcome, dear Fred.
Thank you very much, Claudia, and it's a great topic for today, and I'm looking forward to the presentation and the discussion we are going to have.
Very good. Thank you very much, Fred. All right, and with that, I have the pleasure of introducing you to Kenneth Svensson, who is going to make a presentation on the evidence-based approach, the need of data. I will stop sharing my screen and you can take it away, Ken.
Thank you very much. Can you see my screen?
Yes.
Yes, perfect. Okay, as we heard, I will talk about evidence-based approach, the need of data. And I will talk about different kind of data that we use in Sweden for our traffic safety work. And I would like to start with a database that is very important for us. We call it STRADA, and it stands for Swedish Traffic Accident Data Acquisition. And it's a database that record police reports and also hospital reports regarding traffic accidents. And of course, the police know a lot about the location of an accident, and also information about the road conditions and weather conditions and things like that. And they also try to guess or determine the injuries of the road users, but they don't really know. But on the other hand, the hospital, they know very well the injuries that person can get in an accident, because they treat these patients. And this data, it's recorded in a common database, and you match those reports using personal numbers and day and time and things like that. And it's a very useful tool for traffic safety analysis, and it's used by many different partners in Sweden. And if we look at this database, here we see a common police report to the left, and that's, you can see a sketch of the accident, and there are also information about description of what happened and also weather condition and things like that. And to the right, you can see a hospital report where you can have a very good description of the injury that was a person had during the accident. In this case, it's just a fractured elbow. And if we continue and look at the coverage from the police and hospital, and this is data from 2016. That year, it was almost 19,000 police reports in the system. And the hospital reports were 28,000, and it was a match there between 7,500. And from this picture, you can understand that not all the persons that the police have reported as injured needed treatment in the hospital. And on the other hand, quite a lot of people that needed to go to the hospital, those persons were not known by the police. And you can see also there was quite large group where we say there are pedestrian fall, or a pedestrian that trips on a pavement, for example. It's not a traffic accident according to the definition, because there are no vehicles involved, but they injure themselves in the road traffic system. And there are quite large number of people that get these kind of injuries, and it poses lots of costs for the society. And without the hospital data here, the injury data, we wouldn't know about the magnitude of the problem. So if we just continue here and compare the police reports with the hospital reports, and look at the severe injuries, and you can see the police reports to the left here. And if you look into that data set, you can see that it seems to be the car occupants that are injured most. But if you compare that with the hospital data, then you see the major problems seem to be bicyclists that are injured in road traffic. And in a way that makes sense, because if there is maybe a bicyclist that have a single vehicle accident, falls while out biking, it's not necessary that they call the police, but they feel they need to go to the hospital to be treated. So depending on what kind of data you use, you can get kind of different understanding of the situation, but both sets of data are very important for the traffic safety work. And you can also plot these accidents on a map like this. And of course, this is very valuable for any city planner to see where did the accident occur, what is the major problem here. And yeah, this is very, very useful, of course. So this is hospital data, police data. But in Sweden, we also perform what you call in-depth studies of fatal accident. So all fatalities in road traffic in Sweden undergo an in-depth study by accident investigators at the Swedish Transport Administration. And we look into the road to see if there were any deficiencies on the road. And also we go out and look at the vehicles involved in the traffic accident. We can, for example, see if the seatbelt has been used or not. And we also get quite a lot of information regarding the road users involved in the accident. For example, in Sweden, almost every person that are killed in road traffic accident, there's an autopsy performed. So we can get information if the person have been under the influence of alcohol and drugs and things like that. So what is an in-depth study? We say that it's a detailed investigation into each fatal road accident with the main objective to identify what caused the fatal injuries. So it's not with the objective to see whose fault it is. That is the police job. For us that are responsible for the roads, the main objective is to understand why people die on the roads that we are responsible for. What can we do to prevent that? And it has been a routine in Sweden since 1997 when the Swedish Parliament adopted the Vision Zero, the Vision Zero in Sweden, and it's regulated in the government's instruction to the Transport Administration. So this is something we need to do. And as I said, we have accident investigators that gather this information, and right now we are 9 investigators that perform this work in Sweden. And we say that there are 3 questions to be answered. That is, what happened, why did it happen, and what can be done to ensure that it does not happen again. So that can lead to a measure. For instance, on these pictures here, you can see we have put up a guardrail, and that's a very, very local measure. But in many cases, there are more general measures. We look into our guidelines if they can be improved, or is this a common problem on many places in Sweden? Then we might do some kind of analysis and see if we can improve the situation on all those locations, so to say. So now I've been talking about crash data, about injury data, but in the traffic safety work, it's also important with other kind of data. So then I would like to talk a little bit about what we call road safety performance indicators. And if you look at the road transport system, unfortunately, we know that there are quite bad consequences. We have a number of fatalities and seriously injured in the road traffic. And we try to have measures in order to improve the situation. But we know that sometimes the number of fatalities can go up a year, even though we have done quite a lot of measures, because there's a random fluctuation in the figures, in the statistics. And that can sometimes be quite scary for politicians, that the number of fatalities goes up, even though we have put in quite a lot of effort. So there's something missing in this picture here. And that is road safety performance indicators. And that is a set of indicators that measure the safety level of the system. For example, it can be about drink driving. What is the proportion of sober drivers in the traffic? It can be regarding safe roads, for example, the proportion of traffic volume on roads with medium barriers, because we know that these roads are very safe. Or it can be about the use of seatbelt or helmets. What are the proportion of occupants using seatbelt? And this is something that can be observed looking into the traffic itself. And we have targets for the number of fatalities and seriously injured, but we have also targets for those road performance indicators. So we have And we know if we reach those targets, it will lead to that we also will decrease the number of fatalities and seriously injured. And then, of course, we have measures to try to work with these road safety performance indicators, so they will be better and their road safety will be better. And this is very important. It's very dependent on the institutional framework, that there is, for example, a political will to work with this in a city, in a region, in a country. If there is legislation in use, for example, the speed limits, is that in agreement with the road function? Is there a leading agency regarding traffic safety and things like that? And sometimes we call that the in that part like the input to the system, and the measures that we get out on the roads, that is the output, and the outcome is the safety performance indicators and how they go up or down, and also the consequences in the number of fatalities and injuries. And of course, it would be good to measure the implementation of a safe system in a city or in a country or in a region. And this is something we're trying to look into, if that can be done in a project within the World Bank and ITF, International Transport Forum. Can we find a set of indicators that can measure the implementation of a safe system in a region? And that is a work that is ongoing right now, and we hope to come up with something later on there that can be useful. So, for example, within the European Union, we have a long-term goal here. It should be close to 0 death and seriously injured by 2050. And then we have interim targets that we should have 50% fewer death and seriously injured between 2020 and 2030. And then we have these performance indicators within the European Union. We call them key performance indicators. And we also have targets for those indicators. And the key performance indicators within the European Union are these here, like speed, safety belt, helmet, and so forth. And of course, then you need to collect data about these as well. But what if you don't have good data? What if the data is lacking and so forth, and bad quality? What do you do then? Then you can't work with traffic safety. Is that the case? No, that is not the case, because we know that Vision Zero or the safe system, it's based on what a human can tolerate when it comes to handle trauma, to what the human body can tolerate in a traffic accident. And we know, for example, a pedestrian that is hit in speed that is 30 or higher than 30, then that pedestrian will not feel very good. It can even be a fatality. So with the basis according to Vision Zero, you can still work proactive with traffic safety, even though we don't have good data. And here I had some pictures from different parts of Sweden. We have a picture from Gothenburg, where I live. You can see the picture down to the left there. You have pedestrians crossing a street, but you have fences there to direct the pedestrians to a safe place to cross the road, and you have speed bumps to make the speed slow on the vehicles, so it's safe for the pedestrians. Or if you have a roundabout, that is also a very safe solution. You will not have that dangerous side-on collision. If there is an accident here, it will be much less energy involved and not so many injuries. And we work a lot with 2+1 roads, as we call them in Sweden, where we have 2 lanes in one direction, 1 lane in the other direction. and then we can increase the speed to 100. In other cases, we have a lot of speed cameras, and we have like maximum 80 kilometers if we have like oncoming traffic. So you can still work with traffic safety, even though we don't have very good data. That is something I think is very important to remember. And I think that was all. Thank you for listening.
Thank you very much, Ken, for such a great presentation. And now we want to hear from you. So Alejandro, are we gonna have the Menti poll?
Absolutely, Claudia. Thanks so much, and thank you, Kenneth, and everyone for being here with us today. I see some people already gone ahead and started filling it up, but I'll go ahead and share my screen. Excellent. And I'm going to ask everyone to go to www.menti.com, and on your phone or your device, it will ask you to enter a code. This code will be 7803493. Again, 7803493. I see some people already filling up the questionnaire. The first question will be, what are the greatest barriers to using data for the safe system? And you have several options. 1, cost to obtain data. 2, availability of data. 3, capacity to analyze data. 4, georeference data. And 5, quality of data. You can enter up to 3 responses. So we already got 5, and we're slightly ahead of schedule, so we're gonna give you a few minutes so that we can get as many responses as we can. Also make sure that you enter the correct code. If for some reason, either the Spanish or Portuguese slides showed a different code in previous slides, please ignore it. The correct code is shown here above in the screen that I am sharing, 7803493. We'll give you just about 2 more minutes. All right, then we're going to move to the next question. So I am activating the next slide. And that should show up on your screen now. We already have a few answers. The question is, what information does your city require to move from isolated interventions to a safe system approach? And the options are location of crashes, seriousness of injury, types of road user involved, type of crash, speed of road users, and last, impact of speed management on travel. Looks like we have a few answers already coming in. We'll give you about a minute or two. And same as last question, you can enter as much as 3 answers. We'll give you 1 more minute. Excellent. We see that speed of road users is an important one here, followed by seriousness of injury and location. All right, thank you very much for all of you who participated. And I will stop sharing my screen and give the floor to Claudia again.
Thank you very much, Alejandro, and thank you for all your participation. Now we are going to have our panel discussion, and I would like to introduce again Fred Workman, who is going to be moderating the panel. Fred, if you could turn on your camera. Wonderful. And we have Kenneth Svensson, Nan Tran, Sarah Whitehead, and Segundo Lopez. They will be joining the panel. And with that, I leave it to our moderator, Fred, to take it away. Thank you.
Okay, thank you very much, Claudia, and thank you, Kenneth, for this presentation. The title of your presentation was Evidence-Based Approach. Evidence-Based Approach. That was the title of your presentation. And we are discussing today a safe system approach. In your evidence-based presentation, you presented the beautiful Strada system. I know it very well, and it's one of the best in the world. You added to that the activities you are doing in Sweden on using safety performance indicators, not only measuring it, but also using it for decision-making on your policies. And to me, the question came just before we start giving the audience the floor. The question came, what changed in Sweden due to the fact that Vision Zero is now the policy approach in your data system or your collection of data systems? So what changed due to that?
Well, for one thing, we started with our in-depth studies of fatal accident the same year as we adopted Vision Zero in Sweden. So we understood that we need good data, and in a way, the fatalities in road traffic are the most, we need to understand why people are killed in a system that we are responsible for. We can't just sit there and blame the victim. We are responsible for the roads, and we need to understand what happened. So that data has been very, very useful for us during the years. And of course, the Strada system also with this hospital data has been fantastic when it comes to research and understand what can be done in the infrastructure to improve it. So both this works has been based on the Vision Zero, so to say.
Okay, I'm still waiting. Thank you very much, Ken. I'm still waiting for some questions from the audience. Allow me to give the floor then to the panelists to respond to the presentation by Ken and bringing us update with their experiences for using data, perhaps when you are involved in dealing with safe system approach, or whether you are involved in evidence-based policies. So I'm interested to learn from you your experiences dealing with current data, and also addressing the issue of poor quality, because that's of course was responded in this small survey, the poor quality and how to handle that. So I go through the panel, and allow me to start with Segundo, because you are local, you have some experiences in Latin America. So Segundo, let me start with you to respond to this question.
Hi, Fred. Sorry, what is the question?
So the question is, do you have any experience with working with road safety data to support safe system?
Oh, thank you. Yes, I do actually in some levels, because the first approach I had with this type of experience was in Bogota, where we helped building the road safety plan, which had a safe system approach. And it was a very good experience because we could have a plan that was data-based in Bogota, which was very uncommon at the time. It was 4 years ago. And I think it was a key factor in this plan, because it helped both the city understand its problem better, but also understand how to act more efficiently and how to have the very good results that the city is having right now. So for instance, with data, we could analyze the issue with speeding in Bogota, which also developed a following program, a speed management program that is also having a great impact. All of it based on data. It helped us making the diagnosis, but also helping with local case studies, because in our countries, it tends to happen that we think that, oh, this works in Sweden, but not in our countries. But with data, we can make these local case studies that obviously tend to show that most of these measures also work in our countries. It also helped us doing research, because there is not enough research in our countries, but if we use the data for this, it will help us improving the measures, understanding its impacts and everything. And also, I think there was another place where I think it was key in the safe system approach, and it was working with this methodology in road safety. I don't know if this is something in Europe or developed countries, but there are many myths around the safe system approach. For instance, let's say speed management. Many people think that it creates more congestion, but it is a myth, because it is not like scientifically based, or it's not based on data or any theory. So we have also used data to try to tackle these myths and help us both with the inside the city and to improve the impacts of the measures in the safe system approach.
Okay, thank you very much, Segundo. Then allow me to move to Sarah.
Thanks, Fred. So we've worked with quite a wide group of cities, not always specifically within a Vision Zero or safe system context, but always evidence-based approaches to road safety, whether the cities we work with define that as a Vision Zero approach or not. I think Segundo has really described, some of the most effective approaches in the cities that we've worked with, one of which was Bogota, and the impact of the work there. I wanted to talk first about, drawing from Ken's presentation, that linking of police and hospital data. That's a critical piece to be able to even define who are the serious injury cases. So in most of the places that we work with, there's relatively good police crash data. You can identify the deaths, is the first group you want to focus on. But getting to that next layer of defining the serious injury cases and what are their characteristics is really critical and can't be done without the linkage of police and hospital data. So that work has proceeded very well. Fortaleza has a lot of experience with that. I know we have a colleague on the line from there. In Sao Paulo, there's been a lot of work on that linkage. I just wanted to emphasize that, you know, that's a really useful next step in places that have a decent crash data information system and need to move to being able to define who the serious injury cases are and the characteristics of those crashes. I wanted to also come back to your point about data quality. Nobody has perfect data. Everyone has weaknesses in their data system when they start in on this path of a safe systems approach. That should never be a barrier. It is by working with and presenting and visualizing and using the data that you have that you start to understand the quality deficiencies at a much finer level and start to be able to address those one by one and improve them. But I don't think it should ever be seen as a barrier to moving forward. Even, for example, if you know, speed data was listed as a very high priority amongst the respondents to the poll. Obviously, speed data is critical, but you can start by looking at your fatal and your serious injury crashes and where they take place and on what kinds of roads and who's being impacted. Is it vulnerable road users who, you know, have that increased vulnerability to the energy transfer? So as the systems are being built, there's no need to feel shy about using the data that are in hand, whatever quality they are, to start along the path. Thanks.
Okay, thank you very much. Then I give the floor to Nam and to learn his opinion or view on this.
Thanks very much, Fred, and thanks very much, colleagues. I won't repeat what has already been said, just to reiterate that I think in terms of the issues around data linkages and the lack of data quality, I mean, I think that's a really important point. At WHO, as many of you know, we publish reports that are based largely on country data. And we look at even just the number of fatalities, and we see that there are huge differences between what's reported by the police, what's reported by the health sector. And in the course of the work that we've done with countries to try to improve this, we've looked at linkages, and it's not just between police or transport and health. It's even trying to look at data from, for example, insurance, which is actually has a very rich amount of information that can be tapped into. And we find that actually for example, in Thailand, when we did this work, we found that when we looked at the insurance, we looked at the police, and we looked at the health data, that there were cases that were captured by each specific data set that were not represented in any of the other ones. So it just goes to show that even when you're looking at fatality, it can be quite challenging. But I want to go back to your question, Fred. Your question is really about how do we use data to implement safe systems? And for me, there's two parts to that. We've been talking a lot about, and Kenneth has shown really excellent examples of the outcomes data or the indicators of performance, as he describes it, that help us understand whether or not the principles of the safe systems are being applied. And by principles, I mean the idea that a mistake, somebody's mistake should not cost them their lives, that we should try to design the infrastructure in a way that facilitates the quote unquote right behavior. And I think that perhaps Kenneth, I mean, Sweden has evolved so much that you haven't maybe thought about all of the other data that you actually have about the system's performance, because those come so second nature to you. And I think this is true for so many high income countries. But when we talk about safe systems implementation in cities and in countries that are not at the place where Sweden is, we see a very different set of challenges and perhaps questions. For me, one of the first things is about the interaction between the different sectors. For example, the fact that you actually have a mechanism for linking data between police and health sector is an indication that you're working as a system and not just as individual sort of silos. That's one thing. I think there are other questions. When we talk about the system working, it's good to have legislation, for example, on drink driving, but it's also great, and this is particularly things that cities in particular can play a very important role, or actually have authority to do, to see whether or not where are the pubs or where are the outlets that sell alcohol located? Are they in places, or are they in bars that are places? Do they support the drink driving laws? Are there hours at which you can buy alcohol that makes sense? So if you don't want people drinking and driving, then the way that you structure the city and the way that you identify where alcohol can be sold, where alcohol can be, where marketing for alcohol, those types of things actually reinforce this idea of not drink driving. And when we think about a system, often we think about those types of things. So you think about the immediate outcome that you want to address, which in this case is drink driving or preventing it. And yes, laws are good, but beyond that, we can ask a number of questions about what are the other things within a city, for example, that can be done in order to reinforce that law or reinforce the message that drink driving is not a good thing. Maybe you have things, for example, such as free public transport, or you have schemes that have free taxi rides for people that are too drunk to drive. And so again, I think that, often, thinking about the safe systems is thinking about not just the one outcome, but thinking about the other things that exist within the city or within the environment that actually help to make that work. And so for me, when we think about the types of questions that are linked to safe systems implementation, it's often about those types of things. And the last point I want to make in relation to this is that, and I see there's a question that was sort of alluding to this, is, safe systems or Vision Zero was really sort of grounded in this idea that, a person making a road user making an error should not, pay the price of death or an injury for that mistake, and that people are not perfect and that we ultimately will make mistakes. And I think over the years, we've evolved our thinking even further than that. And the idea is not just that people make mistakes, but the idea is that we should design systems that are in alignment with how societies and people use their cities and use their urban infrastructure. So it's the same question that you have. You can design a crosswalk, a bridge crossing, and we know that those things don't work because people don't want to have to walk upstairs and downstairs to cross the road. So again, you can say that, yes, that design is, preventing people from making mistakes and blah, blah, blah. But fundamentally, for me, that's an indication that the design doesn't correspond to the needs or preferences of the people. And here, when we talk about safe systems, I think a very important piece of the safe systems data or information is understanding the needs and preferences of the society and how people use roads, how people use their urban environment and how they choose to live there. And designing systems that are take into those factors into account. So for me, that's a very big part of the data that's needed when we think about, sort of a safe system. So it's really about, what it takes to make a system work, as well as the outcomes we look at when we see a well-performing system, like is the case in Sweden.
Okay, thank you very much, Nan. Let's say, to summarize this, the importance of linking different databases to have a comprehensive and full and correct picture of the problem. I think that's obvious and evident. And to link police data with hospital data is not an easy job, as a matter of fact. We know that. However, I can recommend everyone to give that a try. And I have no idea whether that can be only at the level of a country or also in your own city. But please have a look at that, because as Ken just illustrated, if you only use police data and you have the problem of underreporting, then there is a chance that you have so-called biased underreporting, that you don't have only 90% or 80% of all the crashes, but you miss, for example, bicycle crashes. That's famous. Second important item just raised was to add to your crash data on safety performance indicators. And there's a lot going on in the world these days on which indicators are relevant and how to measure them exactly. But I do believe that's important as well, because there you can learn far more better and faster how progress is being made than just using police data and crash data. And the final point is that we need some sort of measurement on how far or how good we are on implementing safe system. And that's working in progress. And as Ken said, we have a group from the World Bank and International Transport Forum working on this issue right now, this year. And hopefully we will have some sort of result out of that next year. And I guess we are going to have that. And I certainly invite you to have a sharp look on that and use the results of that, because then you will learn that road safety data to measure progress on how far we are on implementation safe system are different things. Okay, thank you for this contribution. In the meantime, I collected a couple of questions from the participants, and allow me to start with those questions related to data, because I've seen a couple of questions not really related to data. Of course, we can deal with them as well, no problem, but let me start with data. And the first question is, how dependent are we on data to design our policy? How dependent are we on data to design our action plans? Is that for the short term? Is that for the midterm? Or is that for the long term? Is there a difference? Ken, can I start with you to address this issue?
Yes, if you have good data, of course, then you will know what is the main problem, and you can deal with it in a good way. But if you don't have good data, you can still work proactively with traffic safety. As I think I mentioned in my presentation, we know the level of violence that the human body can tolerate. So we can do an inventory and see where in a city do we have critical areas where, for example, pedestrian is mixed with heavy traffic, for example, and we should try to implement a measure there to either separate the vulnerable road users from the traffic, or we should try to lower the speed in order for the pedestrians to survive an eventual crash. So even though you don't have the best data, with the Vision Zero or safe system approach, you can still work proactively with traffic safety. But of course, with data, you can do even better.
I fully agree with your answer. Personally, I make a difference between knowledge and results of data analysis. And as we all know, in the meantime, safe system is a so-called proactive approach, meaning that we are not waiting for crashes, analyze them, and then act. And as Ken said, we have knowledge, and the speed issue is a great issue to illustrate that. We know the forces on the human body, and we know how to manage, that we need to manage speed. And there's no need to wait for a data analysis in your city or in your country to know that speed management is a key issue. And we know that from our knowledge in the meantime. And the next question is what to do and how to get it done. And I think it's important that you understand the difference between the knowledge we have, underpinning everything related to safe system, and the data analysis we need to be more specific. And I think that's a great issue. And let's say the challenge for you all is, where do we rely on the international knowledge, experiences, evidence, and where do you need to include your own data analysis? That's a big question for you all, And that's for us as well, by the way, it's not specifically for you. Thank you, Ken, for that. Another question is, are citizens important for data collection? Or is that an area for the experts and for the data collection people? So do we need citizens? And then, of course, it comes to my mind how to deal with surveys and ask for opinions and things like that, and attitudes and awareness from your citizens. How important is that for policy making and for action plans? Anybody interested to answer that question?
I think it links back to the previous question, which is how dependent are we on data for making policy change? And that question of how dependent is related to the policy context and the community opinion context that you're working in. If there is a strong support for a Vision Zero approach already, then having data to sort of prove and demonstrate your local context is less critical. But if we, going back to the example that Segundo was talking about in Bogota, trying to implement something that's politically really challenging, like speed management, where there are all of these beliefs about what that will do to travel times and congestion, as false as those beliefs might be, having good local data, both to show what the problem is and to quickly show the efficacy of making changes can be critical in shifting public opinion as well as policymaker opinions. This question of surveys, I have less expertise. I think there's a lot of different ways that we can try and understand what community opinions are. Surveys are one of them. Having community consultation processes that we always do in any kind of planning, whether it's transportation planning or not, those are critical approaches as well, not just the kind of quantitative survey approaches. The focus groups and the discussions and the community meetings and all of those kinds of things need to be part of any planning process regardless.
None? You try to take the floor?
Yeah, I was just going to weigh in on this question about citizens' involvement in data collection. And I guess there's two ways of looking at that. One is the way that we've been talking about in terms of citizens being themselves the respondents to surveys, focus groups, but they themselves are the ones that are providing viewpoints and opinions about whatever questions are being asked of them. And I do think that there's a very important role, because as I said, I think it's extremely important that beyond the knowledge base that you've talked about, Fred, that when you're designing sort of the safe systems or applying the safe systems principles in a local context like a city, it's extremely important to understand the user viewpoints about how that application happens. Because safe systems for me is a broad set of principles, and how it is applied may differ in different settings. Certainly we understand the role of speed and all of that, but determining what is an appropriate place to have a lower speed and why that's important. I mean, I think that really requires the inputs of local people. The other point that I wanted to just raise for sake of interest is, there is a growing movement of this idea of crowdsourcing. And when we talk about countries that don't have well-established data collection systems, I'm talking specifically about countries that are not Sweden and not the Netherlands that have really elaborate systems, that people are starting to think creatively about how do you benefit from that type of approach, whereby somebody can use technology that's readily available to most people now through their mobile devices and capture and report a crash event that goes somewhere. Now, this has not been systematically tried. I don't have good examples, but I think that as we think about the technological revolution that's happening at the current moment and the way that information is being shared, Twitter, Facebook, all of these things, we can imagine a scenario whereby that type of benefit is applied for the purposes of data collection as well. And this could be things for crashes or injuries. And obviously there are issues related to, confidentiality and quality of data. But I think that there is growing potential that has some merit, certainly, and it's worth considering, because I think that in the absence of strong systems that you see in Netherlands or Sweden or in other countries, that we can think about innovative ways of collecting data in real time that's fast. So I think it's an interesting idea that's worth exploring.
Excellent, thank you for that. Segundo, any additional remark on this?
Yes, thank you very much, Fred. Adding to what my colleagues already said, I think it is key to involve the citizens in collecting data because, for example, in the general approach, if we would like to also analyze what's going on in road safety specifically for women, I think there is a concept that is not completely analyzed in current data of road safety, is that precisely those trips that are not being made because of road safety being a barrier as well for some people, especially, for example, for women. And I think I saw a question in Portuguese regarding that how do we collect information about people who are not getting in crashes? And I think they're precisely a case, and this affects road safety is not just about the injuries, and it is a huge issue, and I agree that probably is our main goal to decrease the amount of injuries and fatalities, but additionally, because this was already mentioned by my colleagues, but additionally to that, I think road safety is also going to have a huge impact in access to the city, especially if we take into account subgroups such as women or maybe even in low-income areas that can be, for some reason, in some of our cities, in our countries, infrastructure tends to be worse in those areas and therefore having a bigger impact on their access and everything else that is related to that.
Okay, thank you for that. There's a question, first of all, coming back to someone who asked, assume that police data and hospital data don't match. Well, that's not an assumption, that is a reality. So we have techniques in the world where you can match both databases. We know how to link them. It's a technique and you have to be pretty advanced of doing that, but it's available. So those who have an interest to link police data and hospital data and are interested in the technique how to do that, we know how to do that in the meantime, and we learn how to do that, and it depends on the data, the two data sets you have. But you can send me a mail and I can guide you in the right direction. So that's a question from Janina. I have another question, and that comes close to the things Nan just said, and that is the phenomenon of exposure to risk. And that's also an area for data collection. And that coming from Ronaro Ferreira, do you have data about users and vehicles that do not get involved in crashes? So you have a population in crashes, you have a population not involved in crashes, and sometimes you link both to each other. And how do you collect these type of data? Who volunteered to answer that question?
Let me start, Fred. So there are a number of ways of that we've experienced. In many countries, they have annual or regular health assessment surveys or national demographic surveys or things similar to that, whereby they collect information on health outcomes, but they also often collect information on exposure. So they ask people questions, for example, related to whether or not somebody in their family, they've had an accident or they've been involved in a crash, they've had an injury. And the reason why this is important is because, as you know, I mean, a lot of times there are injuries and fatalities that appear neither in the police nor the health data because they never get reported. So at WHO, we rely quite a bit on civil registration and vital statistics because there are often information that is reported there that were never reported to the police or to the health, to the hospitals because the person may have died at home the crash that was never reported to the police, and then they went home and they died, or they died after, or something like that. So I think that there are, you know, in many countries they have routine surveys that are implemented, and it varies from country to country. But over and beyond that, I think it is possible, if you're interested, to do a community survey to ask them about the perceptions and exposure to things like crashes, or whether or not, as Segundo has mentioned, people are not traveling or going places because the mobility are unsafe for them. So, I mean, these types of surveys can be extremely useful. And again, I mean, there's well-established methodology that can be used when doing these types of surveys, and they can be done fairly cheaply, because we don't need of the entire population. Often what we do is we collect a sample that is representative or represents the people in the community, and depends on the size of the community, but many times these types of surveys can be done for a very reasonable amount of money, and for within a very short period of time, that produces actually very important and insightful information. Thank you.
Could I add a note?
Yeah, please.
Yeah, so many places do mobility surveys on a regular basis. And I think, you know, these origin destination surveys, or alternate approaches to understanding patterns of mobility in your city, vehicle counts, capture vehicles only, but other kinds of approaches to identifying, sometimes using big data also, to identifying how people move around and who moves around in what ways in your cities. That really is a data source about your whole population, and you can compare the characteristics of those from those sources with those who end up in crashes, and then to get an understanding of those who are not in crashes, as the question started with.
Okay, thank you. Ken, you didn't include exposure data in your overview. Does it mean that you don't collect that type of data, or do you think it's less of relevance for road safety policy?
No, I think it's important. We do surveys every year. We ask public, but maybe that is another angle. For example, we ask the public about how they view traffic calming. How do they view our speed cameras, and a lot of question regarding traffic safety, and that is quite important data. For example, I remember when we started with our speed cameras in Sweden some 30 years ago. People did not understand why we had those cameras, and there were a lot of sabotage and things like that. And we understand that we need to, in a way, educate people as well why we work with things. Otherwise, things will not be accepted. And of course, this is also the case for decision makers. They also need to be educated somehow. So with these surveys, we can see how the public's view are on different issues, and we can also understand if we need to have campaigns in order to educate the public. And now, for example, very many, or a large proportion of the Swedish population are in favor of our speed cameras, since we are very open with them, and we have had campaigns to educate people about these. We call them our lifesavers. We don't call them, and we also inform the road users with a sign before the camera. There will be a camera ahead, because the main reason why we have these cameras is to decrease the speed and the energy in the system, and that saves lives. It's not to get in a lot of money to a purse. So data is needed in many ways.
Okay, I can add to that experience, perhaps a Dutch experience. Many of you will know that traffic calming residential areas is very important in my country, and very much at the heart of the safe system approach in my country. And we managed in the meantime to have about 80% of the road lengths, the urban road lengths, is now 30 kilometers per hour streets, 80%. And the question is, why is that? And the simple answer is because there was a lot of support in the population for that type of traffic calming. And we know that because we surveyed the population. So then you know that if a government is proposing speed reducing measures, it's not against the will of the population, it's in line with the will of the population. And if you know that and you have the data, you can use that. So that's in support of what Ken just said. And I have another observation in line with what Nantran just said. As a matter of fact, we have a dashboard for following and monitoring COVID-19. And that has been published since half a year now. And that our health authorities publish that every 2 weeks. And part of that dashboard is transportation. And for transportation, they measure the number of kilometers walked or cycled or by public transport or whatever. And they use mobile phone data for that, so the big data. And day by day, you can see how many kilometers have been traveled in the country. And that was not available 5 years ago, but now it's available and you can use it as well for your own purposes, and they use it to understand whether we are less active traveling to work or traveling to social meetings, things like that. So that's an important support also to be used for road safety, and that's not very usual right now. Allow me then to come up with another question, and that's interesting, not so much with data, but nevertheless it's of interest. Traditionally, we blame the driver for having a crash. Now we come up with this concept of shared responsibility, meaning that it's not just the driver or the road user, it's also those who design and operate the system and components of the system. What does that mean for data collection?
I can start a bit. We adopted the Vision Zero in 1997 in Sweden, and exactly the same year it was decided that we need to get more information about all the fatalities in road traffic. So we started with our in-depth studies of fatal accident. And of course, one reason for that is we that are responsible for the roads, we need to understand why people are dying out there, because ultimately a lot of responsibility is on us that design the system. We need to design a system that is survivable. If people make a mistake, you should not be punished with death. So of course, a safe system approach will change the view and the need of data.
Okay, thanks for that. Sarah?
I think even more than changing the approach to data collection, it really changes the approach to the interpretation and the analysis of data. I've been sitting here struggling to think about what are the data collection approaches that shift, but what's obvious is if we're shifting our framework for understanding responsibility, then, for example, looking at a question like drink driving and understanding where is that risk based, you know, in by age and in new drivers and all that we've learned about the needs for graduated licensing. That's part of a system, that's part of a regulatory system that leads to more safety. We wouldn't get there to understand the importance of those kinds of policies, of restrictions on certain kinds of drivers and their need to slowly increase their credentials as drivers and to limit to zero their allowed alcohol level. We wouldn't get there if we didn't think of this about as a you know, a regulatory system that we are also responsible for, to say, you know, this is how it needs to work. This is a risk that we can predict. It's not just young people's fault. It's a system we need to design. So I think it's more about how we interpret the data and how we think about what the questions are we need to address.
Okay. Nan?
Sure. I was actually I was thinking about this as well, and my answer was going to be sort of Sarah's last point, in that I think it's not as much about changing the data collection as it is about changing or rethinking about how we approach the types of questions we ask. And it's understanding, again, I go back to the point that, you know, it's not just about saying a user who makes a mistake should be forgiven and not penalized by death or injury. It's thinking about, is the system appropriate to the way that users are using the road or interacting with the system? You know, we often, because I think it's an important distinction, because it's not about the designers coming in and saying we should be design systems that are safe. It's about understanding designers coming in and saying, what are the needs of the users in this place? How do they interact with their environment? And how do we design road systems or mobility systems that work with those, the way that people live? A while ago, Fred, I don't know if you were on that discussion, you know, somebody showed a picture of a person carrying a bunch of bananas on the back of a motorcycle as an example of why we need to really apply a systems approach. And that example was cited to say that, look, this person is making an error and a mistake, and he shouldn't pay for that mistake with his life. And, you know, it started a discussion about us thinking about, well, maybe that person is not choosing to do this because he or she, you know, is feeling reckless, but it's out of necessity. And it's the way that people need, and they don't have a choice, so that's what they're doing. So rather than making a judgment about whether or not we think that's the right choice or the wrong choice, we should be thinking about what are the user needs and how do we design systems around needs so that they're in a line. And that's why I say that it's one thing to have safe systems principles at the local level. This is where cities really have the power to apply that in a way that's consistent, coherent, and culturally appropriate with how their populations are using. So for me, the question that you were talking about, it really goes back to this question about what are the needs of the users? And the question I would ask is then the system responding to those needs and the way that people interact with their environment? Less so than pointing blames or making judgments about whether this is the right choice or the wrong choice. It's really about, are the systems responding to the needs? And that is a question. And I think there are lots of ways, by the way, to answer that question. There is ways of collecting that data. It's not often collected as part of safe systems assessments, but one of the pleas that I'm making here is that we should be thinking about those types of questions when we think about safe systems implementation. Thanks.
Thanks, Nan. Segundo, some thoughts on this?
Okay, thank you. I'm going to sound very convenient, but I completely agree with my colleagues. I think the essence of the safe systems approach is especially that stop this blaming and going to making a system that is going to be accepting human error, to take that into account, because we're humans and we make mistakes. And another thing is that I always think that variable is very controversial, because in order for a fatality or an injury to occur, there has to have been many errors in the system for it to happen. The design, maybe the license system, also maybe there was not an ambulance close enough. There are many errors that have to happen for a fatality to occur, and to which I think is not ideal to focus on these errors, but rather on a systemic way. And that's why it's called a system approach. So I think, and this is why I completely agree with Sarah and Nam and everybody, because I think it has to change the way we see the data. We have to, this is why, for example, geographical data is very important. We have to and try to come up with a systemic way of solving all of these issues, rather than blaming it on one part of the system, but rather on the whole system of as such.
Okay, thank you for that. When one of my strongest recommendations when it comes to support of safe system is to neglect the data field on the police report indicating the cause of a crash. My students are never allowed to use that, and I have a good reason for that, because it's in that field you don't have the cause of the crash. You have an indication of what type of violations are being observed by the police, and they fill it in. And as a matter of fact, they pick always the most easiest one to prove necessarily in court. And that doesn't give the right picture of what happened in the crash. And as Ken said, you learn that far more better when you have this so-called in-depth investigation in which you are open to all the flaws or defects of the system instead of just pinpointing on the individual user. So we are framed by these police reports in the past to think that everything is around human failures instead of system failures. And I think we are going to move away from that. But the police is not always very happy when I make that statement. But after a discussion, I think we can agree on that. Allow me then to raise one other issue, if you have still time for that, and that's coming from Fernando Pinto, and that's on data, but a different type of data, and that's communication. Communication between those who are designing safe system, whatever, and the population and the citizens. And how do we communicate about introducing safe system or the positive effects of safe system with our citizens? How do we do that? And what are we include in that communication? Is it too complicated for the panel? Sorry for this complicated question. Perhaps I can start with an answer, because we do have some sort of experience with this. So as a matter of fact, we started to introduce safe system from the beginning of the 90s. And safe system was discussed at high level of government with politicians and policymakers and decision makers. And it's pretty advanced when you think about that. So we ask ourselves, should we communicate about this change in paradigm with the population? And then the results of our deliberations was, no, don't do that, because it's not so easy to understand what it implies for individual behavior or individual decisions. So we said, okay, let's communicate about the concrete interventions included in this approach, instead of trying to sell this complex approach. And we are still happy with that choice. And whether it's the best choice, I don't know. But we found it complicated to sell something like safe system to the population. So we never did that. None?
Yeah, I don't have personal experience with this, but I think that I was going to concur, say something along the lines of what you just said, in the sense that I don't think people, and I don't know how to say this correctly, I think people are concerned about road safety and deaths when we see the numbers, but the average person, when they think about mobility, is not thinking about safety all the time. I think people want they want to know that the system is easy. They want to know that it's convenient for them. They want to know that they can get one place to the next. So I think, the idea of the safe system is really that we are embedding, if you will, safety as a value of the mobility system, so that you don't see the externalities of deaths and injuries on the side. And what we're trying to do is do it in a subtle way that people aren't aware of that. But what's communicated is really about a really good mobility system, because that's the point of mobility. It's about getting from one place to the next. We just talk about road safety because we're seeing such a high level of negative externalities, unintended outcomes, which is the deaths. But the mobility system was never designed to prevent road traffic deaths. The mobility system was designed to enable people to move about. And that's what people want ultimately. And we don't want to have the deaths to go with that. But often that's something that is difficult to talk to people unless it's something that you just need to embed into the system. So, I mean, in Switzerland, for example, or in the Netherlands, I'm sure if you ask the average person if they're consciously thinking about it, their answer is probably no, because it's so, they're thinking my mobility gets me from one place to the next. Of course, in other places where you don't have that, then it becomes an issue. But
Okay, thank you for that. Sarah?
Can I just add a thought? And I'm thinking about the experience that our colleagues in Fortaleza have had with some of this. I completely agree with you. Trying to have a public communication effort about a framework or a paradigm shift is unhelpful. It needs to be, community communications need to be concrete and specific. And I think this idea that Nan is just talking about, it's not just about safety. People think about places that they want to be, places where they want their children to be, to enjoy being and to be comfortable. Part of that is about safety, and part is about the design issues that create safety, slow speeds, narrow streets, all of these kinds of things also make places just more comfortable for humans on foot. So I think that some of the framing and communication around what kind of community do we want to live in, what does it feel like, what does it look like, is another way to bring in the safety issues in a little bit of an indirect way.
Yes, I fully agree with that. I think this can finalize our panel discussion. We covered all, I think, that I've seen, and I added a couple of myself to you, and apologize for making them too complicated now and then. But I think it was a great discussion. I thank you all for being on this panel and to answering these questions. And then I think it's my turn to give over to Claudia again.
Thank you very much, Fred, for a great discussion today and for our wonderful panelists. Thank you, Ken, Sarah, Nan, and Segundo. Today, we have learned about data, a key and very, very important component for the safe system approach. I think it has been rather illuminating to understand first that blaming the victim is not the way to go, and that if we find that type of data, we have to question that. And we have to understand what are other pieces in this complex puzzle that we need to put in place. So today it was fascinating to hear, for example, how we need to sense our community and see if the community, for example, is ready for changes as drastic as speed management. And if they are ready, we might not need to have that much granularity in data, but just act. Because as Ken was saying, we know exactly how dangerous are streets if we have speed set up at high levels, in particular in urban areas. We already know the results, and collecting more data will not make any much difference on that, unless we really need to work more with our decision makers or our communities, as you, Sarah, were saying very, very well. Perception is also important. It also matters how our communities are understanding the changes. We might want to survey them and listen to them and see if what they want is safety or also better environments, places that really make us feel well-being in those places. I think what is important is we don't need to have a perfect set of data. We need to have good information that can help us make good decisions. I want to really thank you all. This webinar is recorded, so we can listen again and share it with other colleagues. I really believe that this is a key piece when we start building our programs based on the safe system approach. I also would like to invite you on December 3rd to our last webinar, and we will be talking about what comes next. We have been learning throughout these weeks about the safe system approach. We have looked at children, speed, data, and now this is the moment to reflect on how we proceed in the future. We will have a wonderful panel again. So thank you very much for joining us today. Thank you very much, Fred, for a wonderful moderation. And I look forward to seeing you soon again. Thank you and stay safe, please. Take care. Bye-bye.